This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
This was an interesting little study I saw recently. Say tranexamic acid is kind of one of the favorite medications that we use here in the emergency department for all things bleeding, whether it's epistaxis or significant trauma bleeding. You can try and use TXA to help with the bleeding. So there was an interesting study out of Korea recently that looked at using TXA for hematuria. There was one small previous study, and this was kind of the second study looking at this. It's still pretty small. I'd say it's not proven and ready to be mainstream, but what they did was they took patients who had gross hematuria, which can be, kind of a frustrating thing. Sometimes we're putting in a 3-way Foley and irrigating forever, and there's persistent clots and problems. So they took patients, they put a Foley in them, and then they put a gram of TXA in their bladder, let it sit for 15 minutes with a clamped Foley, and then they basically did continuous bladder irrigation and waited to see if the main primary outcome was length of stay in the emergency department. And with TXA, it was dramatically shorter to how long they had to stay in the emergency department. They also looked at things like how long the Foley had to stay in for, whether the patient needed to be admitted, whether they bounced back to the emergency department. And it was all better in the group that had this TXA in the bladder. So it seems to make sense. The study wasn't big enough to really look at safety downsides, but it should be very safe. It's pretty safe when you give it IV. So just putting it in the bladder seems like would be very safe as well. So, like I said, it's not necessarily proven in large studies, but if you've got someone who's got like really stubborn hematuria and something that could potentially be worth trying, and I think there's a lot of downsides to it. So any questions, comments? All right. Thanks, everybody.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.